So, my talk today is a case study on myself. When the healthcare professional becomes the patient. And you can literally thank Sister Marie Thomas, the Mother General of Sister Marie Simon Pierre from France, because as she came and spoke to us, a few years ago, actually 2012, it was 1 year after that I ended up with some pretty significant medical problems. And through these years, we've remained very close. And she said, Marie, you've got to tell your story. And I'm like, I don't like sounding like my own patient. So I feel in my heart that you need to hear from my side what I experienced. And I'm hoping it will help you and enrich you and how you can experience this through me as a healthcare professional. So, September 18th, 2009, I tripped over a power cord in my office and fell, and I sustained a right knee injury. Okay, no big deal. I went to a very prominent orthopedic surgeon in Boston. I had arthroscopic surgery October 2nd, 2009. And it was a partial medial and lateral meniscectomy. And I basically to me, it was just a minor surgery. So being the worker that I was, I went back to work in 7 days from my house and was calling patients. And of course, I have a staff that works with me. And my other nurses took my patients for this time. But as the owner of MedLink, I own MedLink, which is a catastrophic injury medical case management company that I founded in 1984, and we specialize only in catastrophic injuries. So as the years went on and I had more complications, I needed a total knee replacement. And I was so careful, it took me a year to choose the surgeon. Okay, I did all the research, I looked up all the numbers. I didn't pray about it. This to me was clinical data. I was like, okay, I've got to get the best person and I've got to really take control of the situation and choose the very best doctor. So I underwent surgery for the total knee replacement November 25th, 2013. And I was at a very prominent hospital in Boston, the top surgeon, and I didn't work with him in particular because our cases never need a total knee replacement. They usually lose their leg. So got through the surgery, and I'm in the recovery room, and I remember having a tough time waking up. And all of a sudden, I started calling for my son. I still to this day don't know why I was calling for Joe. But I was calling, and apparently calling very loud because he could hear me out in the waiting room. I was the 7 a.m. case, and it was 12 o'clock, and I still really wasn't out. So the nurses, to shut me up, brought him in, and he's in his 30s, so everything's fine. And then all of a sudden, within a few minutes of his arrival, I had a respiratory arrest. So the way that the nurses even found out I wasn't breathing is because my son was there, and even though the nurse taking care of me was standing right there, it was he that noticed, because my alarms were off, that my respiratory rate was going down to 2, 1, and so he started yelling for help. I had a Narcan injection, woke up, and I remember thinking, wow, that was the most delicious sleep I ever had in my life. And I had a second respiratory arrest. So, little to say after that, they had the whole anesthesia team in there. Another, I don't know how many doses of Narcan at that point, but they brought me back. I never did have a cardiac arrest, but that was the most stunning event in my life. And I still to this day wonder what the Lord had planned for me to go through such an experience. And if my son hadn't been there, I'm sure the alarms, somebody would have noticed eventually, even though the alarms were not working in that particular monitor. So I wasn't transferred to my room until 6 at night. And then my surgeon comes rushing in, and he said, the whole hospital heard about this. I'm so sorry. I don't know what happened in anesthesia. I'm just newly appointed at this hospital, and maybe the anesthesiologist and I, maybe we should have spoken more, but during that time, they had the procedure of putting the narcotics directly in my knee. And so between having the narcotics infused into my knee to decrease the pain, which was his special procedure, and the anesthesia and then pain medication on top of it, I wasn't going to be breathing about that. So stayed in the hospital 2 or 3 days and subsequently was transferred, I'm very proud to say, to Spalding Rehabilitation Hospital. And went there November 27th. I was an inpatient until December 7th. And basically, it was an uneventful rehabilitation. And I say that in mind, tongue-in-cheek, as a catastrophic injury nurse, because all of my patients were there. And so I was doing the physical therapy, I was doing everything what I thought was the best, but I always felt like my right leg was just not stable. I couldn't understand why I couldn't stand on it right. There was an issue with it. So I had to use platform crutches. Of those of you that don't know what that is, they're crutches where you're walking with your hands up here. Because I have arthritis, I couldn't push down. So kind of looked like a duck. But I could walk, and I was very happy and grateful to God for that. What was enjoyable to me is that I ended up bringing a bunch of the nurses' books, Nursing with the Hands of Jesus, A Guide to Nurses for Divine Mercy. And I brought a ton of the Divine Mercy images with me. And I'm thinking, well, I'm here, I may as well try a little evangelization, and I would leave everything out on my desk. And it was pretty amazing because the staff kept coming in, they wanted more images. Pastoral care came by, and I requested to receive communion every day, and they're like, every day? I said, yeah, I go to Mass every day, so I want to receive the Lord. And so they made special arrangements that they would come in, and so I could receive the Lord. So I had this incredible experience, was discharged home, and I kept these meticulous medication sheets and I was on alternating doses of OxyContin and Dilaudid, back and forth, back and forth. And of course, I'm trying to wean myself off. So I started to notice that I wasn't sleeping very well, and then one morning, January 9th, I'll never forget this day, I woke up with severe pain in my right hip, and it was like screaming like a knife had gone through my hip. So I paged the physiatrist, who just loved getting paged at 10 a.m. on a Sunday. Let me tell you, that was special. And I told him what was going on. He said, get in here tomorrow. And so I went in, saw him, and it was a proximal IT band tendinitis. And little did I know later, it was because of the laxity in the joint. So he gave me an immediate injection. I had multiple visits with him over the course of the next 4 to 5 months. And in the meantime, I'm still in physical therapy 3 times a week. For a knee replacement patient, that is high test. So in the middle of all this, because of the OxyContin and the Dilaudid, even though I was weaning down, I started to have tinnitus, which, of those of you who don't know what that is, it's ringing in your ears. That's so bad, you can't concentrate, you can't sleep, there's nothing you can do. So I get on the phone, call the world expert at Mass General, thinking, oh, they have the answers. I go to Mass Eye and Ear, place that I love. They said to me, after multiple testing, multiple evaluations, this is back and forth, right, to Boston, that there was no treatment for it. And they had multiple other medications that they wanted to give me that I won't even go into. And I said, I can't live like this. I cannot take all this medicine. I want to go back to work and take care of my patients. I really don't want to be the patient. So finally, after getting off the medication, the tinnitus persisted. I still have it to this day. It's kind of, for me, like a little reminder that the Lord's with me. But thankfully, it's low enough that I can sleep or get through it. So the next thing I noticed, because I used to be a CCU nurse, that I was having more PVCs than normal. I used to have PVCs, occasionally, and it was no big deal. I was noticing, I could feel them, that I was having multiple PVCs. So it ended up, I had a referral for sleep study, and my oxygen was in about 76. On the sleep study. So they're like, okay, you've got obstructive sleep apnea now. And I'm like, really? Okay. So after a trial of 15 masks, I finally found one over the course of the year that's barely acceptable. So if there's any respiratory therapists here that have any hot tips, I'm all ears. But at least I don't feel like I'm going around in a coma, because with that kind of lack of oxygen, it's very, very devastating. So I had underlying fibromyalgia, trips to the rheumatologist, and I'm keeping track of all my medical visits, and I'm like, boy, I'm starting to look like my own patient. This is not good. So in order to get well more quickly, I wanted to do more therapy. So I kept going to physical therapy 3 times a week, plus I started a swimming program on my own. I used to be a competitive swimmer. I have another bachelor's degree in physical education, so it was either nursing or phys ed, and I couldn't decide, so I became both. So I had my own training program going at a local hotel pool. I was doing laps 30 minutes a day, at least 6 days a week, plus therapy, and I wasn't getting any better for tolerance. My leg kept bending backwards, so I kept getting buckling backwards. So you know how you see, yeah, it was not good. I kept falling. So I had these physical limitations. Standing tolerance was 10 to 15 minutes. Driving was about 15 to 30 minutes, and that was really pushing it because of the IT band pain that wouldn't go away. So in order for me to see patients, I had to leave for Boston an hour and a half ahead of time and just stop on the way, take a break, coffee, whatever. But I was determined that I was going to go back to work and see my patients. So with the distances at these large major hospitals, as you know, Brigham and Mass General, you could walk a mile easily without ever breaking a sweat. I found that I was restricted to going to valet parking, having the opportunity to really depend on others for parking my car, for making sure the appointments with my patients were scheduled so that I could get there around 11 o'clock in the morning and then get out of Boston by 2, because anytime after that, you may as well go to the North End for dinner, because you're there till 7 with all the traffic. So finally, I got smart. I said, Marie, you have to get an independent evaluation because you're not getting any better. So I saw actually Dr. Brian McKeon, who happens to be the doctor for the Celtics, but he's also a ligament specialist. And literally within 30 seconds of him working with my leg and feeling it, he said, Marie, the spacer that they put in your knee was the wrong size. I'm like, really? You're really kidding me, right? He said, no, I'm not. And as a matter of fact, I'm on the board of I have a conformist knee implant. He said, I'm on the board. I'm going to call them with your permission and see what we can do about it. I'm like, okay. That's when I had the take back moment, and I was saying, Lord, what's going on? Okay, I'm way beyond the question of why. It's a question of what. And I found myself in this situation. I was still able to go to daily mass with difficulty, but I would go. But I realized all I had was my faith. I had to depend on the Lord to guide me through this, because all of a sudden, I wasn't the one directing my care. Jesus was directing my care. It was like he was saying, I want you to experience this and realize what your patients are going through, even though, thank God, it wasn't a huge trauma, but the sequela of these multiple problems and not being able to get resolved, I felt like, okay, did I do something wrong, Lord? Why are you picking on me? What is it? I'm supposed to be in charge of my patients, my company. I'm working with the healthcare professionals for Divine Mercy. I'm supposed to direct that, okay. And now I'm fitting seeing my patients that I love in between my own appointments, and I could barely make my own conference. And hardly people that have been here before would see me walk up the steps and say, man, is she gonna make it up there? So I learned that I really had to depend on the Lord and the sacraments. And then I started to become more reflective. And talk about having a noise in your head all the time. I normally, when I'm driving into Boston, I would pray multiple rosaries going in, multiple rosaries going out. At night, really didn't turn on the TV. I was too busy with patients, but I'd have my time of prayer and meditation, and I'd like to go to adoration. I was able to go daily before this all happened, but then it became more infrequent. But I found if I didn't take that time to pray, and if I didn't really take that time to reflect, I couldn't survive it. So Dr. McKeon referred me to New England Baptist, and I had a brilliant surgeon that saw me, and they decided to do surgery within 8 weeks. And this is the plan for the surgery. Okay, just imagine yourself in this situation. First of all, there's only 3 possible options for this knee implant for a spacer. So the plan was they have to reopen the whole wound, 18 inches of suture line, right? Open everything up, try to fit in the piece and see if it'll work. If that didn't work, I had one shot at it, then they were going to tear out all the hardware, redo it with a striker knee. And I said, well, okay, I already had 2 or 3 surgeries on this leg. It's already got some kind of huge screw in it, and they actually could have split the tibia with the repeat. So I'm thinking, okay, Lord, I am definitely not in charge. This is all about you. And so with tremendous pastoral care support from Father Seraphin and Father Kaz, my pastor at the time, I had the surgery. My son was there, all my family, and the most important thing was that I was able to receive the sacraments before I went into surgery. The chief of anesthesia was there because he said, there's no way this is going to ever happen to you again, and I was able to have a spinal for the surgery, which was wonderful. So thank God the one part that could work worked. So it was just incredible. And I got transferred back to Spalding because my case was obviously a little bit more complicated. And it was at that time that I started seeing the same staff again. Oh, Marie, you're back. I said, yeah, I'm back. And this time I've got like 5 cases of books, 5 or 6 cases of holy cards. And my room became like a pastoral care center. And I kept seeing some of the same staff, and we would talk and reminisce, and they would share with me, oh, Marie, we we need more of these nurses' books, and we've used them. And I was just like, okay, Lord, now I'm starting to understand why you brought me here. And as it turns out, I was on the 5th floor where all the Boston Marathon bombing victims had gone. So I was talking to the staff, and we were sharing faith, and let me tell you, it was heavy duty. Talk about a healthcare professional ministering to another healthcare professional, and what they saw and what they experienced. And during my time at the rehab, I would still see some of the patients coming in for physical therapy. And I'll tell you, when you see the dancer in a wheelchair and she's got her serial cast on and they're trying to reduce the swelling, it takes pause. And you say to yourself, really, nothing's wrong with me? I'm okay. I'm really okay. And I remember going up to her and saying, you know what? We prayed for you. And she didn't know what to say. I didn't know what to say. That's all I could say. And I also saw the young man that his wife was pregnant at the time of the injury. And he's a bilateral amputee. And I saw him walking with his soon-to-be wife, 2 or 3 therapists, walking with his prosthetic legs. And I'm thinking, it's such a privilege to be here. This is the hardest part of the journey. The crisis already happened in the ICU, but this day-to-day grueling therapy and not getting better, I suddenly realized what the Lord was showing me. It's what these people go through. They're in rehab for 6 months to a year. I can relate to that. So I kept going back to St. Faustina's diary every single night. I left it at home because it's by my bed where it always is, but I've got all these little stickers all over it. And I kept reading and reading how St. Faustina dealt with this, because so many people in her community, A, they didn't believe her that she was sick, but B, she was so sick and yet she was still working. And I'm thinking, okay, I have to figure out a way to continue my work and also be able to be aware that I have physical limitations that I really wasn't ever expecting. I never considered that I would have such severe and varied complications, and I was acutely aware, time and time again, of what would have happened if my son hadn't been in that ICU. Because honestly, he shouldn't have been there in the recovery room at that point. So, knowing that I could have progressed to a cardiac arrest and even more, I thank God every day that this didn't happen. So I had to reconsider my schedule. How was I going to coordinate daily mass? How was I going to get to adoration? How was I going to go back to work even, 6 to 8 hours a week? Because I really felt that was my connection, was my patients. And because I was in physical therapy for over 7 months, 8 months, how many knee replacements? I got the sense from the insurance that they were considering I was like one of those fakers. I was just there because I love having 2 surgeries and just love falling and not being able to work. So I really stuck to the diary and said, St. Faustina, you did it, so I can do it. Jesus is with you. I know he's with me. And for some reason, I've got to figure out, maybe I'll never know why this happened. So knowing that St. Faustina went through this suspicion, is she really sick? Is she just trying to get out of work? As much as I tried to help myself, my medical complications were so unexpected and severe that it's when, from the experience of St. Faustina, as to what the acceptance of what our Creator, our all-knowing, all-loving, and all-powerful Father permits us to experience and endure with trust in his tender mercy, that I really began to understand and appreciate the value already in this life of my sufferings, intentionally united in prayer to the sufferings of our Redeemer and Savior on behalf of others. So I started praying for my patients, because I can hardly imagine what they were going through. And one quote from the diary that was one of my favorites is the conversation of the merciful God with the suffering soul. And I don't know about all of you, I still have a tough time accepting suffering. Frankly, I hate it. But I understand the value of it. And that comforts me. And when I understand what the Lord suffered, then I realize I really need to grow up and understand that this is what the Lord wants. So Jesus said, "Poor soul, I see you suffer much, and that you do not have even the strength to converse with me. So I will speak to you. Even though your sufferings were very great, do not lose heart or give in to despondency." Now, isn't that a track where we could all take that? Oh, poor me, what can I do? I've seen it time and time again in my patients. And I'm reading this diary, and I'm thinking, you can't go there. You absolutely cannot let yourself go there. You have to keep praying. Our Lord said, "But tell me, my child, who has dared to wound your heart? Tell me about everything." So the soul says, "Lord, my sufferings are so great and numerous and have lasted so long that I became discouraged." And our Lord says, "My child, do not be discouraged. I know your boundless trust in me. I know you're aware of my goodness and mercy. Let us talk in detail about everything that weighs so heavily upon your heart." So at that point, I'd get my stack of medical records, we're like this now, okay, and say, "Okay, Lord, how are we going to solve this problem?" Because I didn't plan on all this. And I have to say that during the time, especially immediately after the respiratory arrests and then trying to go back to work within 6 months, I found myself having word-finding problems. It seemed to be, I had slow mentation, and normally I'm like, bing, 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 sharpest attack, and I'm like, oh my goodness, this can't be happening. So I'll tell you what I did. I prayed to St. Stanislaus. And I was so exhausted and so tired, because by then I hadn't even been diagnosed with the sleep apnea, but I had this low oxygen, so it really affected me. And, we have all those novena prayers to him that are fantastic. I was too sick to pray them. So what I did, I said, "St. Stanislaus, help me." Throughout the day, every night before going to bed. And I like to tell you, he takes his time, okay? He took 9 days to cure Barbara. And I'm like, little quicker here, please. Didn't work. So, but what happened over the course of the next month, I never stopped praying to him. I noticed that all of a sudden I was picking up. I could talk what I would consider to be normally. I was reading medical records and everything was clicking. And I don't know if that ever would have come back again if I hadn't asked him for help. But the reason I'm telling you this is because, we all have patients that can't pray at times. They're too sick, or their family's too sick, and they get overwhelmed when they see this huge novena, like, oh my God, I missed the day. I tell them, you know what, just say, "Please help me." And just like Sister Gaudia was saying, please help me. These people are coming to us for help, and then when we need help, why is it so tough for us to ask for help? So that's what I did. I asked him to help me. And I'm standing here today, able to speak correctly and know what's going on until I get older and older because of prayers to him. And he's my hero. I can't tell you, reading those Vatican dossiers and seeing all the medical records, I was stunned at his intercession. So the prescription medications, I want to sort of go into that because I was really aware of the debilitating effect that this pain medicine had on me. And I don't know if I couldn't metabolize it properly, but clearly I wasn't able to handle it, even though I'm talking about 5 milligrams of OxyContin and 2 milligrams of Dilaudid. I mean, that's a tiny dose. But I didn't like myself when I was on that medication. I was spacey. I couldn't really carry on a coherent conversation that made any sense. Obviously, I couldn't see patients. I realized that something was wrong, but I couldn't put my finger on it. And then I realized, you know what? I have to stop. And so I called my doctor and said, how do I go cold turkey off of this? He said, you don't. So, we did a little taper schedule, and it took me about a good week to get off. And then it took another month to really get it out of my system. Why am I telling you this? Because I realized that not only did the narcotics take the pain away, but it took my life away in a very real sense. And I want you to know that this is what your patients are going through. And it's hard for me to understand people with addictions because I don't have an addiction other than to my iPhone. I won't tell you about that, Sister Gadia. But it was a reality check for me to realize that when I finally, quote, woke up, I realized how much I had missed and how devastating this could have been to me. What if I couldn't get off this medication? And believe me, I have plenty of patients that are long-term chronic pain patients, and I understand how they feel because this is very, very debilitating. At some times during this time between 2013 and 2015, I was so sick, I didn't think I could continue the work of the healthcare professionals for Divine Mercy. I didn't know if I could organize the groups that our annual conference, write speeches, really be present to people. But I was starting to think maybe feeling bad's normal, and then I'd go back to the diary and see how St. Faustina felt and how she just kept working. As bad as she felt, and I'm like, okay. And I kept thinking, well, I can do this revision of the book when I feel better. And after 6 or 8 months, I started thinking, Marie, you got to start writing because you may never feel better. That was a huge reality check for me. Our patients are going through this. One of my most famous patients, Mark Tuttle, that's on the back of the book that has come here, he lost a third of his body. And he said to me, Marie, I finally realized I had to just go on living my life without my leg. And it was okay. And his wife used to joke, I only love one-legged guys. Gloria's amazing. But when I had to go to the hospital, one of the times I called Mark. I said, Mark, will you come and pick me up? Because I wanted to be with him. I had discharged him 10 years before. Of course we stay in touch. You never lose touch with patients like this. But it was his inspiration, his strength, going through 2 years of rehab, prosthetic training, all sorts of things. I'll never forget about Mark. The first time he stood up was on the Feast of Our Lady of the Rosary, and I videoed it. I said, Mark, you are going to remember this day the rest of your life. He's in the parallel bars, terrified. Can you imagine if from your waist down, your whole body's gone? We kept fighting for him. And I realized it was that fighting spirit that I needed from him to help me. So, the privilege of me taking care of these patients and then they're taking care of me is amazing. So during that time that I was back in the hospital and in rehab, and between the same hospital stay and the rehab stay, I was able to start seeing patients on a very, very limited basis. So one of my patients was a spinal cord patient, and I didn't want to give him up, and I said to the team at Spalding, was on the 7th floor for the spinal cord patients, I said, look, I can't get here. The team meetings are at 7 or 9 in the morning. I'm like, forget it. I can get here at 11. Would you guys mind if we have the team then? They said, of course. That team scheduled their teams around me when I could get there. Who does that? They were amazing because they knew I was so committed to going back to work and being with my patients again. They wanted to help me, knowing that I was a patient on the 5th floor. And of course, I would wander around the hospital and go back up to the 7th floor, and they're like, why are you dressed like that? I said, don't ask any questions. This is not my best day in that beautiful hospital garb. So when I was seeing this patient, I went for the team meeting, and of course I was behind the desk. I had to pick up things. Can you imagine that this book was sitting at the nurses' station in the back where the nurses and doctors chart, and it was open, and not only were there a million little stickers, but there was underlining, yellow markers. I was like, okay, Lord, I get it. I finally understand why you brought me here. And it was so touched my heart that they were using this book as a manual like it was intended, that it seemed like all the suffering that I had gone through for those 2 years, it was like, okay, it's worth it. It's really worth it. And then the director of nurses comes out, oh, Marie, you're here. You know, you have a few minutes to talk. Of course, we want to share. And so it was a whole different approach on that unit. So I firmly feel that I was able to get through these medical events with Eucharistic adoration, daily Mass as often as I could, and of course, I have to say that if I had not kept participating in the sacraments, I don't think I would be here today. Because otherwise, there's complete emptiness. Knowing that Jesus is truly present in the Blessed Sacrament was all I needed to know, that I had to get out of bed, I had to make it to Mass, and I wanted to go. So I don't think I could have survived such a trying experience. And I never forget I never forget on that November day before I went into surgery in 2013, where I set my voicemail. Okay, my surgery's November 25th. I set the voicemail to say, I'll be back on December 15th, right? 3 weeks after a knee replacement. So everybody please call me, because I'll be happy to return your calls. So I have to say, this is a classic illustration of how our unrealistic expectations at times do not match up with God's plan for us. Accepting which is best, the best way to attain peace, the state of security and perfect well-being promised by our Lord Jesus to those who fully place their trust in him. Jesus, I trust in you. Thank you.